So when we think about a preterm baby, a full-term baby, and a baby and breathing, normal neonatal breathing patterns, and I'm talking about babies from birth to about 6 months, are irregular. They are not consistent and they're not the same all the time. So they can either breathe fast or they can breathe slow. And if you think about it, when they were in the NICU, we were seeing their breathing patterns anywhere from 40 to 60 breaths per minute versus an adult that does about 10 to 20 breaths per minute. So they breathe a little faster, and that's a very normal thing. They can also take pauses, and that's when the ding would happen possibly when they're a little bit younger, because when they take a pause, they don't have enough energy sustained in order to kind of keep up, so they might have a little drop in their heart rate or a little drop in their oxygen saturation when they had these pauses. But it can be very normal for newborns to have long periods of pause. They can also be noisy breathers. So because babies breathe exclusively through their nose so that they can latch onto the breast and breastfeed at the same time as breathing, anytime there's any little bit of fluff or booger or anything in the nose, it will make for noisy breathing. So you can hear them rattling a little bit if there's something in there. You definitely know when there's boogers in there. They'll sneeze when there's fluff in there, like air fluff, and they'll just sneeze, 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 that kind of a thing. That's because this is their main breathing passage, is the nose. And if you've looked in the nose, I mean, even looking at this little thing, these are two narrow, tiny little passages for air to get through for all the lungs. It's not the same as the way we can take a good deep breath. Babies don't do that. So they can sneeze, snort, whistle through their nose if there's one little thing perfectly positioned, and they can also grunt a little bit. Go to the next one. So when we look at the airway itself, there's a lot of different components to it, and depending on what area can be affected, it's very different. So you have the very small nose passages, then you have the larynx and the pharynx over here, which is when you get laryngitis or it's more the voice box. Then you have the airway itself and then the lungs itself, which end in these little alveolar saccules. And so you can have irritation or inflammation kind of anywhere along these places, from the nose to the pharynx or larynx to the lungs themselves, like a pneumonia. So if you plug your upper chambers, when we're talking about your nasal passages, what you're going to hear is what we just talked about: whistling, grunting, snorting, sneezing. That's if your upper airway passages, like your nose, get blocked. The next one. Sometimes your pharynx can get blocked because babies might regurgitate milk a little bit. So you'll hear kind of that in the back, like that's where there might be milk sitting in the pharynx or in that area. And so that makes its own noises. If you feel like the baby is getting a cold or having a problem in their chest, this is where it'll be at the level of the larynx. Here is where you feel like the rattling in the chest. It's not that you feel like the chest itself has mucus or problems in it. It's more that when you put your hands on the chest, you can feel like a little rattling vibration from probably kind of here in the middle of the neck. And that's when you're at the level of your larynx. Can you go to the next one? And then if you actually get pneumonia or you have a problem with the lungs, that's when you're going to see something more. You're going to see that the baby is going to be having more difficulty with breathing. And probably in the first 2 weeks of each of your baby's lives, they probably had some respiratory issues going on. So you know what it looked like then versus now, in that they can turn blue, they can work really hard to breathe, they can use their whole body to breathe, where they're kind of bobbing like this and their belly's breathing like this. And then they can kind of suck in between their ribs with the things they call retractions. So you guys probably might have seen all that. It's very clear that these are all disease states and that they're not actually what breathing should look like. So let's look at a normal baby breathing and demonstrating some of the things that we showed, but is actually normal. So we're going to watch a little video. Okay, so this is, can you guys see? This is a normal breathing pattern. So you can see the baby's using a little bit of the belly to breathe, and you probably can't hear, but he's making little snorting sounds, but otherwise is very comfortable sleeping. Color is nice and pink. You don't see any pulling in the chest or anything like that. See how they make a little noise? That could have been any baby in this room that just made that little noise. And this is what we would see. So you can sometimes see a little bit of belly breathing, a little bit of fast breathing, but the main thing is look at the face. Does the baby look like they're in distress? Do they look like they're comfortable? Do they look like they're pink? We don't have a pulse ox on this baby, but this pulse ox is probably 99%, you know, but you can see they're using the whole body to breathe, but still actually very normal. Can everyone see kind of that? So let's look at the difference. Okay, can you see the difference in this baby who's quiet, maybe making some sounds, but do you see the difference in the belly in terms of how they're breathing? Do you see how you can see the ribs getting outlined with the breathing? Baby's still pink, but you can see a big difference. Also making these kind of grunting sounds. That's the baby's way of trying to open the airways up a little bit. That's what grunting is. It's trying to bear down a little bit so it can open the airways up a little bit. So when you see that kind of, we don't want to see this, but when you see that kind of physicality in the breathing, outlining of the ribs, work like fast, bobbing like this, then those are going to be signs that the baby's more in distress. Has a face that doesn't look entirely comfortable, like when they're sleeping. Can you guys see the difference in that? So those are the kind of things that you're going to want to see. And I know you're going to know because you see them how they're healthy and how they're breathing. So if you see them breathing in any way that they're not been breathing, then that's when you should get concerned. If it just looks off to you, go to the pediatrician. If it looks like the baby's sucking in ribs, is having a hard time, seems really tired, maybe the color isn't as pink, then you should go to the emergency room. Okay? Can we go back to the slides? Yeah. So when will the noisy breathing stop? When you hear the grunting, the whistling, the whatever. Usually a baby will switch from a nose breather to a mouth breather around 6 months. And so you won't hear so many noises from the nose. And then in addition, at about 6 months, they have much better truncal control. So a lot of breathing depends on the head not flopping around like this, but actually the baby holding the head with purpose, not the upper body not kind of slumping like this, but actually being able to hold their torso, hold their head, hold their body up. Breathing is going to get much better and much easier. They're going to switch from nose breathing to mouth breathing. And then, and again, when is it an emergency? If you hear the wheezing noises, have you guys ever heard what wheezing sounds like? Those kind of sounds. If you turn blue, that's not a normal color for a baby. If the baby becomes limp and you can't quite, like the baby, you pick up the baby and the head is like this and the arms are like this and you're like, you know what I mean? Like if you pick up the baby and the baby looks like this, that's an emergency because that baby should have tone. Any fever in a baby is always a trip to the urgent care or the pediatrician. And then as we said, if the rib cage above and below is kind of sucking in, you're seeing the outlining of it as the baby's breathing, the video that I showed you guys, that's abnormal. And then if the baby just plain old stops breathing, that's 911. Okay? So any questions about breathing? No? Okay.